What you need to know about Ozempic. Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I have Tina Nunziato sitting right by my side. Thank you so much for joining us. If you're a first-time listener, welcome. Please check out our library of 400 episodes. We just did a celebratory episode on our last episode. And if you're a regular listener, thank you so much for being on this journey with us. We love and appreciate you, and we just we know that it's busy for everyone, and so thank you for taking the time. So, what about Ozempic? I'm going to tell you that deep inside, I think that I was ignoring the fact that there was this Ozempic medicine that's out there.
I know. I came to you I want to say 3 months ago about this because Maureen, our nurse practitioner, came into my office and mentioned it to me. I didn't even know it existed.
I didn't either.
And she said to me, she's like, we have to address Ozempic because we're getting a lot of patients in our office that are taking it. I'm like, what is that? And she's like, it's a weight loss medicine. Mm-hmm. And then I started doing some more research on it, and I remember coming to you, and you're like, I don't know about that. I don't know about that right now. I can't do a podcast on that yet.
Yeah. I just wasn't. I wasn't ready. It's like I have to compartmentalize, and I have to pick and choose what I'm going to focus my attention on, every day. And I think possibly the day that you came to me, I was like, yeah, that's going to go over there. So,
so what's changed?
So I think what changed was that just recently, literally in the last 2 weeks, the anesthesiologist that I was working with told me, hey, have you heard that there's been some issues with aspiration during procedures with patients that are on Ozempic? That piqued my interest.
And now it's affecting your procedures.
Because now it's affecting my procedures, yes. And anything that affects the potential, the safety of my patients will pique my attention faster than anything else when it comes to what I do as a gastroenterologist.
Yes, and let me just reiterate that I had a phone call within 30 seconds of that conversation saying we need to change our prep forms.
Yes.
So that's what we've been doing for the last 2 weeks, is changing our prep forms.
Exactly. Thank you very much.
You're welcome.
I appreciate it. We have changed those prep forms through the years whenever something is brought to my attention that has anything to do with the safety of the patient, And so that's what piqued my attention. And so I was like, okay, well, now it's time to learn about this drug.
Gosh darn it.
Yes, and I have to say that the other thing too, that for some reason, and I don't know if it's just like the universe because now this energy's been put out there of Ozempic, but for whatever reason, and maybe it's because I'm listening more, because there are certain conversations that take place through the course of the day that I, literally will zone out, and that way I can focus on what I'm doing. And so now I feel like I'm listening to and hearing more Ozempic conversations. Nurses, techs, just in general, people that I'm surrounded by throughout the day that are taking Ozempic to lose weight. Mm-hmm. Some of them who don't need to lose weight. Some of them who, in my opinion, are perfect the way they are, or if anything on the skinnier side, but they want to just lose 10 pounds, or they want to lose a few pounds or whatever. They want to lose some of the belly fat. And so they've been prescribed Ozempic. And so look, I don't know anything about this medicine. I just have started to do some quick research. This is the little that I found out, and I'm actually going to read from my notes because I just, it's a new thing, a new discovery for me. So apparently there's three medicines, okay? 3 medicines that are out there There's one that's sold under the brand name of Monjaro, and I don't even know if I'm saying it right. And then there's two others that are semaglutide medicines, and this is the Ozempic, and then the other one is called Wegovy.
Right.
And again, I don't know if I'm pronouncing that one right.
So can I mention the history a little bit?
Sure,
behind
go
these,
ahead,
just for
please.
people who don't know, because I'm sure if you're on Ozempic, you probably know some of this already, but if you're not, maybe you're curious. So the company that makes Ozempic is actually a medicine for diabetes.
Yes.
Okay. And somehow somebody was, started losing weight on Ozempic because of and we're going to talk about what the medicine actually does in the body, but they started having a lot of people start taking it for weight loss, which means you're taking the medicine off brand. Okay, that's what it means.
Off label.
Off label.
Right.
And so there was some issues with that, with insurance. And of course, whenever pharmaceutical companies hear patients are taking medicine for weight loss and it's working, of course, you're going to have every pharmaceutical company now jumping in the race to make a medicine just like this. And so Wegovy is actually coming from another company, same exact medicine as Ozempic, but they went forward with it as a weight loss medicine. So technically, Wegovy is a weight loss medicine, whereas Ozempic is a diabetes medicine. They're basically doing the same things, right? It's just whether it's off label versus correct label. So anyway, go ahead and talk.
No, that's awesome. I love that. That's great history on those medicines. They are injections that are administered once a week. Okay, administered once a week. And like Tina said, Wegovy was actually approved in 2021 specifically for weight loss. Okay, whereas the other two, are diabetic medicines. And so how do these medicines work in regards to the GI system? So again, I did not do a deep dive into this. I'm going to keep it very high level. Basically, one of the ways that it works is working on the receptors in the brain that where these medicines work on the receptors to give you that sensation that you're full. Okay, so they work on the satiety receptors in the brain. Satiety meaning, feeling full. Like something, early satiety is when you're getting fuller quicker than normal. Okay, so satiety centers in the brain. You get these medicines working there, making you feel like you're full. They also work on, they also mimic the naturally occurring hormones that help with the motility, with the movement of the stomach. So now your stomach is slowing down. Okay, it's not moving the way it should. And some of you may be familiar with a term called gastroparesis, which is basically like a paralyzing of the stomach. So it doesn't move the way it should. And interestingly enough, diabetic patients are actually a group that is at high risk for developing gastroparesis because as a side effect of the high sugars. Okay, so that's something that we actually see a lot in patients who have diabetes. Okay,
and I would just like to pause there for a second because we see patients in the office all the time being worked up for gastroparesis.
Exactly.
Okay? So this is an issue, right? We shouldn't be having gastroparesis.
Exactly.
We should be eating food. We should be digesting it. It should be moving on. It should not be sitting around in the stomach too long, because if it sits around in the stomach too long, it can cause a lot of problems.
Exactly.
Right? It can cause reflux, heartburn, nausea,
bloating, abdominal pain.
A lot of things. So people are coming in already suffering from these symptoms, but now we're starting to take medicines that are causing these exact symptoms.
Exactly.
So you can imagine when Maureen came to see me 3 months ago, like, I'm seeing a lot of patients on this Ozempic. Why are they here? Well, they're here because now they're having digestive issues.
Right.
Okay.
Right. So it slows down the stomach. So now food sits there longer than it should. Okay? Because food should, the digestion occurs, it needs to be moving out. That is the natural thing that should be happening. But now, because the stomach is slowing down, you've got food sitting there. Maybe food that's fully digested, maybe food that's partially digested, but it's sitting there. Okay, it's sitting there giving patients this full sensation. But now, because it's sitting there longer than it should, now they're going to have nausea. Some people may be vomiting. Some people may be having, what Tina mentioned, abdominal pain, bloating, diarrhea, constipation. And so as a result, because they're feeling full, they're not going to eat, and so they're going to lose weight. Okay, they're going to lose weight. So one of the articles I read was they had interviewed one of the endocrinologists at Mayo Clinic. An endocrinologist specializes in hormones, and they're typically the ones that will also take care of patients who have diabetes. And she was saying that probably up to 10% of their patients that they've placed or started on these medicines, they're having to take them off because of these side effects, because of these GI side effects. How does that affect me, and how did that come up in regards to what the anesthesiologist told me the other day? Well, now you're having these patients who are coming in for procedures or surgeries who maybe didn't eat the day before, okay, if they're having a colonoscopy, but because they're on these medicines, may have a stomach that still is full of food sitting there. And so now they go, they sedate them, they give them anesthesia, and maybe the patient's vomits during the procedure, and now they have these contents that are sitting in their stomach that go up the esophagus into the airway and cause an aspiration.
Which is the whole reason why you're told not to eat
Exactly.
24 hours before your procedure, is to make sure your stomach is cleared out so that there's no chance that anything's going to come up where you can aspirate, right?
Exactly.
That's the whole point. You're told not to eat. So now we have to tell our patients that they have to be off these medicines.
Right. So this is me calling or texting Tina like frantically, immediately. And then us having to decide. The anesthesiologist told me that right now, like, this is new, right? So this is in evolution, and they're trying to figure out, right now they're saying for sure we need to tell these patients to not be on their medicines for, be taking this injection for at least a week before. Is that enough? Nobody really knows at this point. It's too new. So nobody really knows.
They said that this medicine stays in your system for up to 6 weeks. So who knows if it affects, right, the motility for that long.
Right.
But in the prep form, we at least put 2 weeks prior to your procedure being off this medicine. So I think that 2 weeks, because right now we don't know, is going to be probably a very reasonable thing. At least 2 weeks. I mean, the anesthesiologist, we've been talking about it almost every day. He's like, it's going to be an issue. There's going to be some patients who are losing the weight and aren't going to want to go off of it for 2 weeks. So because that's the other thing that I read. There was an article that talked about if you are losing weight with this, you have to continue taking it in order to keep the weight off.
Right.
So it's one of those things is once you start, you can't stop or you're going to put the weight back on. So it's just an ongoing.
Well, and the question is going to be like, is this a medicine people are going to have to stay on for a long time? Or if they take it for a year or two, they lose the weight and they come off, what's going to happen? Are they just going to regain that weight right back?
Supposedly they regain the weight.
Yeah. I think it's too soon to tell, to really answer a lot of these questions. But another thing that was discussed, which I thought was interesting in the article, was, so now you've got people that are on these medicines, they're developing side effects. Maybe they have abdominal pain. Now they're feeling nauseated, they're vomiting, so it's also affecting them emotionally, causing a lot of issues with stress, anxiety. I mean, so there's like a whole, there's like so many things that we're going to be discovering now that are going to start showing up. And it's like, is this a side effect of this medicine?
Right.
Is this because they're having this abdominal pain? And here's the thing, that as these patients come in and they're being referred to us because now they're having symptoms. So now, we're going to put them through a full workup.
Right.
We're going to put them through a full workup. We're going to do procedures, CAT scan, ultrasound, because it's like, what is it? Is it your gallbladder? Because these medicines also have side effects, okay? And I thought this was fascinating when I actually went on the Ozempic website also, okay? So extreme side effects of these medicines: thyroid tumors, pancreatitis, change in vision, gallbladder issues, kidney failure, cancer. Okay? And this endocrinologist that they had interviewed at Mayo Clinic said that the two serious side effects that they're seeing a lot of, that where some of these patients are ending up in the hospital, are pancreatitis and gallbladder.
Mm-hmm. So they're going to have to be worked up either way.
Absolutely.
To figure all that out.
Absolutely.
I do know that, as they've been coming into the office, Maureen and Raquel, both of our nurse practitioners, have been telling these patients to come off of the medicine, that's the easiest way to resolve the symptoms. And some of the patients are going, okay, I understand, I could do that. And some are saying, no, I refuse to come off this medicine. And I think that's the part that's scary, right? That here they are, now they've got, whatever, maybe we were taking the medicine because we want to lose weight, but now we've got actual physical medical problems, and we still don't want to come off the medicine. We're willing to deal with physical medical problems just to lose the weight. And I think that's the scary part of these medicines.
Yeah, and so look, we're not, this is not a bashing session towards the medicines. This is more of something serious has just been brought up to my attention just recently, because I realized that this could actually affect the safety of my patients when I'm doing procedures. To me, that's huge, because I always say a good day for me is the patients did well, the patient went home, and they're safe. Okay? Because that's always my primary thing, is keeping the patient safe in the procedures that I'm doing. And so to me, this has now become a safety issue with this medicine, not to mention all the patients that are going to be coming in now with GI symptoms that we have to work up, because you can't just assume that it is a side effect. Is it a side effect, or is there something else going on? So it's something that I feel that we definitely all need to be aware of. And I finally came to a point where it was something that I needed to not close my eyes on and just ignore. Because actually, when it was first brought up to me, the way that it was brought up to me was, hey, Dr. Cruz, have you heard of this new medicine for weight loss, and are you going to be prescribing it? That's how it came up to me. It was brought up in that way, and I was like, no. And I think that's why when Tina brought it up, I was like, I probably in my head when she said, Maureen brought it up, was thinking, no. And what? We're not going to prescribe it. So, okay, that's end of conversation. If we have to discuss it, we'll discuss it. Well, now I feel that we're discussing it. Yeah. So just, be aware, do your own research, and just know, and if you're somebody that's on it, understand what you're taking, okay? Do your own research. I mean, look, unfortunately, every medicine has its bad along with its good, okay? Because they're chemicals. I mean, at the end, they're chemicals. And so you have to be aware of what you're taking. Be aware of the potential side effects, especially the serious side effects, and just know what you're putting into your body, okay? All right, so if you'd like to connect with us, find us on our website, drlizcruz.com. There's a magenta colored button on the homepage that you can click and schedule a free 30-minute wellness consult. And that is done over the phone, so you can do that from anywhere in the world. If you haven't rated our program, please rate us, and please give us a 5, because that'll help other people just like you to find us easier. And lastly, if you have not subscribed to the podcast, please subscribe so that you never miss an episode. Thank you so much for joining us, and we'll catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.